Hello, I'm Dr. Perry from Farmington Family Dental. Today I'm here to answer questions about dental crowns and answer any questions that are commonly asked to give you a better understanding of what a dental crown is. A dental crown is a solid piece of material that we put over top of a tooth, usually because the tooth is having some structural or cavity issues. That material can be made from anything from porcelain to metal to a combination of the both. And it can be anything in color from a white to a gold or a silver in color. So common alternatives to a dental crown. By the time a tooth needs a dental crown, there aren't that many other options on the table. But in some cases, there can be. Sometimes we will do what's called an inlay or an onlay instead of a crown. Another name for that would be a partial crown or a three-quarter crown are common names for those inlays or onlays. That's where we only really need to address part of the tooth and don't have to wrap all the way around. We can keep some of the natural tooth intact and whole as it was before. Other alternatives for crowns, sometimes the tooth's far enough gone that it makes sense to either crown it or take it out and replace it. Do something like a bridge to replace it or an implant. Now a bridge is something where we put a crown on the tooth behind the missing space and one in front of the missing space. And we hang a fake tooth in between, fused together all in one unit or one piece. An implant is something where we put in like a titanium stud down into the jaw, and it integrates there into the bone, and we put a crown on over the top of it. All those are alternatives for what crowns are typically used for. There are three common types of dental crowns. There's actually more than that, but these are the most common ones. First, and this is an older one, is a gold crown. Most people know those as gold crowns. They look gold or yellow or goldy in color. And they are a metal type crown. They're not very aesthetic. All that said, that's a gold crown. Second type of crown. This one has been an oldie, but it looks a little bit nicer than a gold crown. That's where we take metal on the inside of the crown and we layer a layer of porcelain over the visible areas of the crown. So it still has the benefit of a white or nice look on the front, but it has metal as a substructure underneath it. Sometimes you'll see a little bit of discoloration around the top edge of those crowns. People describe them as dark or silver in color, right around the edge where the tooth meets the crown. Okay. The last type, and by far the most common type nowadays, and has been now for the last probably 15 to 20 years, is a porcelain type crown. There are different types of porcelains, but this is entirely porcelain. It's all tooth colored material without some of the drawbacks of having the metal as far as the aesthetics go. It's a white, it's a nice looking crown. Those are the three most common types of materials that we use today or were used in the past. In our office, we use the porcelain type as almost 100% of the crowns that we do nowadays. Okay, so there are different materials that we use in our dental crowns, and they have different advantages and disadvantages. Let me go through each different type of the three most common types that we use. The most common type of crown we use in my office is zirconia. Zirconia is a metal ceramic crown. Now, when you hear metal, you might be thinking tough, strong, durable, and you'd be right. These are among the strongest crown materials that we have in dentistry. I say among, I really should have said the strongest, period, bar none. They're actually advertised by banging the thing into a 2x4 with a sledgehammer, and they don't break. They'll last. The disadvantages on doing that type of a material, when it's in the aesthetic zone, like it's on one of these front teeth, stronger isn't necessarily better. On the overall appearance on them, I'd give them like an 8 out of 10. They can look nice, but if it's like on one of these front ones on the top, and it's alone standing where it's natural teeth next to the crown, it's hard to make the two match. They have a different look. But I can tell you, in the world, when you see somebody who has a set of veneers done, half of the time they're that material. They're the zirconia veneers, and they look very good when everything is matched together. That actually is one of the best looks people like. People tend to prefer that when you can get it all to match that way by doing it all at once. Okay, so that's zirconia crowns, most common by far. Second most common is a material called lithium disilicate. Lithium disilicate is a glass ceramic. Now, when you think glass, you're probably thinking, well, glass is kind of fragile. It is more fragile than a zirconia. It is stronger than some other types of ceramics that we have, some other types of glass ceramics that we have been using now for 100 years or so, 50 years, like a really long time as far as dentistry is concerned. So good long track record on them, and they're a moderate strength option. As far as aesthetics, I'd give them about an 8 or a 9, well, probably a 9 out of 10 as far as the look. They can be made to look more like natural teeth than anything else that we have. That's a lithium silicate type crown. Some of the limitations or drawbacks on it, including that it's not as strong, we need to reduce or remove more of the tooth structure so we can make the crown thicker than we can with a zirconia type crown or an all metal type crown. So as far as the tooth goes, if we didn't have to take away that much material anyways, we might not want to choose that material. This type material, lithium silicate, probably accounts for about 2 to 5% of the crowns I do in my office, mostly in the front. Okay, the last type of crown material that I talk about is what's called a PFM, or porcelain fused to metal. That's where we have a metal substructure underneath the crown, and we've put porcelain on over the top of it. When we're doing a crown that touches multiple teeth, that's called a bridge, by the way, sometimes we'll use a metal substructure to give it more strength so that we don't deal with breakage issues on it. That can be a big deal on something like that, on a bridge. That works better when it's a longer span. The porcelain fused to metal material works better. It's stronger, it's more resilient. As a drawback on it, one of the things I routinely see on porcelain fused metal, especially after it's been 10, 15, 20 years after it's been seeded, is right up at the top of the tooth where the crown meets the tooth. You'll see a spot there, like at that line, you'll see like a dark shadowing, dark shading. Some people describe it as a silver or a black color because it appears that dark when you smile. That has various reasons that happens, but that tends to be one of the ways that porcelain fused to metal gets replaced, not because they're failing, but if it's on the front teeth, it can be an aesthetic failure over like 15, 20 years. Like it takes a while for that to happen, but it can happen. Yeah, so people will ask sometimes about the dental crown procedure, what that looks like. In my office, we do most of the crowns that we do same day. So that means that when you come in, we'll get you numb, we'll get the tooth shaped and scanned and make the crown in our office. And at the end of the appointment, we're trying it on. As long as the fit is great, we like the look, we cement it that day. Typically, the time period on that, it takes about 15 to 30 minutes to shape the tooth for the crown, and then about 15 minutes at the end to fit it on, with about 45 minutes or so in between where we're designing and making that crown to fit. Overall, the whole appointment length we schedule typically for about 2 hours to do the procedure, and it usually takes between an hour and a half and an hour and 45 minutes to have it done. Gosh, one of the most common questions is this gonna hurt? Great question. So no, dentistry has not hurt like that since your mother was born is the short answer to that question. But our anesthetics are so good. We are so gentle in doing things, especially when we take care of things at an earlier stage rather than when they're a big problem. Doing a dental crown, no, I routinely see it as a very comfortable appointment. What are the consequences of having a crown on a tooth? Any dental work that we have on a tooth is going to have a point where we need to do service on it, replace it, repair it in the future. The average lifespan of a crown that I see from the literature we do as dentists, and this is objective literature, it's not something I see in my practice, but this is objective, is anywhere from 15 to 20 years lifespan out of a dental crown. Now, that varies quite wildly, by the way, based on how well you take care of it and whether you're coming in for your routine checkups to see how things are going. When they're maintained well, they can last much longer than that. And when they're lasting longer than that, the consequences of having it on really, I can't think of very many. In most cases, the consequences are we are able to keep a tooth, and that's great. Children's teeth, are they worth putting in crowns? Sometimes. Typically when it's a baby tooth and it's had quite a bit of damage to it, it would need a larger filling, larger than about 3 surfaces or 3 sides of the tooth are included. Typically what I'll see is it's better to do a stainless steel or a prefabricated crown in that case. A stainless steel crown I haven't talked much about yet is made out of stainless steel. It's a stamped crown. It's prefabricated. It's not custom made. It is a temporary type crown. And those work fairly well for baby teeth because the lifespan we need out of something like that is maybe 6 or 8 years. In those cases, those can work very well. There are other types of crowns. Sometimes you'll see on baby teeth on the front. We'll do what's called a strip crown, where we essentially form and shape some composite and bond it on over the top. And that works very well too. Those types of techniques are typically used in kids because they're quick, they're inexpensive, and they look pretty decent. Kids don't really care. Actually, most of them actually love having a silver crown. They'll tell me, yeah, I got a robot tooth back here. Boys love that. All that said, in an adult, that's not ideal. That's not how we do a crown in an adult. That's reserved for baby teeth that fall out. So how good can this look on your crown? Does it look like a normal tooth? Absolutely can, by the way. And at their best, when we choose the highest aesthetic option for a crown, we can make it look better than a normal tooth. Some people, the way they're born, their teeth are not shaped right. They're too small, they're too big, they have discoloration from braces and things like that. And it can certainly be made to even look better than a normal tooth. In most cases, yeah, a crown looks like a normal tooth. In a lot of cases, you can't even tell when the person's smiling or talking to you that it is a fake tooth. They blend fairly well nowadays. Okay, so are there any cavity problems with a crown tooth? Absolutely can happen. And that's one of the reasons why it's very important for you to come in and have your work checked, and checked every 6 months to see, is there something wrong with this? Is there something that needs to be done? Is there something that needs to change about home care and maintenance to get the best lifespan we can out of it? Cavities happen on a crowned tooth at the border where the crown meets the tooth. The crown itself isn't going to decay. You're never going to see a cavity on that. But that border is the most susceptible point on a crowned tooth for decay to set in again. And it's important that border be maintained well. Gosh, okay, maintenance and care on a dental crown, how does that compare versus a natural tooth? So a dental crown, you just take care of it like a normal tooth. Make sure you're brushing it, make sure you're flossing, use mouth rinse. Doing those things and following the instructions your hygienist gives will give you the best lifespan out of that. The care it's like a normal tooth in most cases. Lifespan of dental crown, according to the literature that's out there, you can expect a dental crown to last anywhere from 15 to 20 years according to this research that we've done as dentists. I have routinely seen much longer than that, and I have seen some shorter than that. But that is the average, about 15 to 20 years is predictable. So does insurance cover doing a dental crown? In a lot of cases, yeah, it does. And for your specific insurance, come on in. I can give you the estimate as far as what your insurance does or does not do, and we'll get you squared away. Okay, so in our office, you can schedule an appointment to have a dental crown done by just giving the office a call. When you give us a call, we'll get you scheduled in for it. Our number is 573-756-5760. I hope we've been able to answer some of your questions on dental crowns. But if you have any additional questions or you're ready to take action, please call us at 573-756-5760.